The AU's Africa Health Strategy is very clear on this point. African countries want sovereignty over their health policy and financing. They want to have more ownership of how they design and finance their health systems. At the same time, it is clear that ODA, official development assistance, is shrinking. In the future, external support will be a smaller share in countries' health budgets. In middle-income countries, external support might even be phased out, in some cases completely. So this alone is reason enough to make health a clear priority in national budgets.
And it is now my distinct honor to invite Ms. Birgit Pickel, the Director General Africa from the German Ministry for Economic Cooperation and Development. Welcome, ma'am.
Good morning, Honorable President Ruto, all excellencies present, ladies and gentlemen. Let me also say all protocols observed. It's a real honor to be here on behalf of the German Federal Minister for Economic Cooperation and Development, Reem Alabali Radovan, who unfortunately will only arrive tonight, but she will be here at the meeting as well to follow the discussions. Ladies and gentlemen, many of us realize the importance of health when we suddenly have a health problem. When a pregnant woman does not know whether she can get medical aid in an emergency, or when a pandemic leads to closed schools, empty markets, and families losing their income. So health, it's not just a matter of hospitals and doctors. It is the foundation for people to make their own choices in life and for social cohesion and progress in Africa, just like in Europe and everywhere in the world. And this foundation is currently under pressure. The world is changing. It was mentioned earlier. What was considered reliable for decades is turning out to be fragile now. We see cracks appearing in the international order, cracks that in some cases are already leading to its collapse. Fundamental principles like international solidarity, human rights, and bodily autonomy are being questioned. And I'm also greatly alarmed about developments such as the expansion of the so-called global gag rule. Global challenges can only be met through joint effort, with international cooperation working together. And this is especially true for health, because disease knows no borders. So it is all the more important that we here today for the World Health Summit regional meeting with a focus on Africa are meeting, and the motto couldn't be chosen better. Innovation, integration, and interdependence are exactly the elements we need in order to reimagine Africa's health systems. Europe and Africa are partners in these reform efforts. We share the goal of a global health policy that is based on human rights and scientific evidence, and on respect and true partnership. Together, we have achieved impressive progress in the past. Since the turn of the millennium, child mortality has been halved, and thanks to the work, for example, of the Global Fund, far fewer people are dying from AIDS, malaria, and tuberculosis than in the past. So these achievements, even in difficult times like the current ones, must be protected by all means. And that requires reforms of the global health architecture. It must become more effective and crisis resilient. It is up to us to move forward in this regard. I believe that 4 points are key for that. First, we need to strengthen health security worldwide. In practical terms, this means in the international community, we need to prevent future epidemics and pandemics at the earliest possible point and ensure that people and countries have quick and equitable access to medical products. This is certainly a lesson learned from the last pandemic. The African Union has set itself the goal that 60% of the pharmaceuticals needed in Africa should also be produced locally. This is an important milestone for Africa and an important contribution towards global health security if we meet this target. Germany is assisting African countries in strengthening local production capacity, for instance, with regard to adapting regulatory systems, trained skilled workers, and enhancing the relevant quality infrastructure. Second point, we want to strengthen country ownership and sovereignty, and this is exactly the spirit I have heard on this panel this morning. The AU's Africa Health Strategy is very clear on this point. African countries want sovereignty over their health policy and financing. They want to have more ownership of how they design and finance their health systems. At the same time, it is clear that ODA, official development assistance, is shrinking. In the future, external support will be a smaller share in countries' health budgets. In middle-income countries, external support might even be phased out, in some cases completely. So this alone is reason enough to make health a clear priority in national budgets. And having said that, even if Germany will remain a reliable partner for African countries, let me stress that point. The third point I want to mention is we need innovative financing instruments. As I said, official funding will probably shrink, at least internationally. Domestic funding will hopefully move up. But there are innovative instruments out there to also meet urgent funding needs in the health sector. Especially for heavily indebted countries, innovative financial instruments such as debt swaps can play a major role. They enable, for example, partner countries to channel funding into their health systems instead of spending it on debt service. Last year alone, Germany committed to cancel 100 million euros in partner countries' debt for debt-to-health swaps. This funding will be channeled to programs of the Global Fund over the next 3 years. Germany will continue to use debt swaps, and we would actually welcome if other countries could use such instruments where they can make a meaningful contribution towards strengthening national health policies. Fourth point, we must make our multilateral cooperation more efficient and strengthen it at the same time where we see multilateralism under threat at the moment. In the international community, we can use our funding in an even more strategic and effective way by establishing closer cooperation among global health funds and countries, and by making sure that programs are closely aligned with national priorities, and also by making sure that the mandates of the funds complement each other without duplication. A few weeks ago, in Sierra Leone, where I, together with my minister, was able to see for myself how well this can work, at a health center that provides malaria vaccines for children and simultaneously educates mothers and treats them for malaria. This was possible thanks to cooperation between Gavi and the Global Fund and, of course, the Ministry of Health of Sierra Leone. This working together, I think, is the way forward for all of us. In my view, these 4 points will be key in order to make the global health architecture more effective and crisis resilient in the future. However, that will only work if we, as policymakers, involve the private sector even more closely in the future. The present summit meeting is sending a strong message in this regard as well. Germany works with its partner countries in creating a reliable and investment-friendly environment for the private sector. In the AU-EU Health Partnership, and I see many other EU member states and the Commission sitting here as well, we work together to strengthen Africa's health and pharma industry in a strong partnership. Together, we want to promote more investment where it can improve medical care locally and continent-wide, and where it creates decent jobs and makes Africa more independent for future crises. Ladies and gentlemen, investing in global health means investing in the lives of millions of people, and yes, also in our common security. Because strong health systems are the best joint defense against crises that go beyond borders and destabilize societies. Germany will remain a reliable partner with substantial contributions, for example, to the Global Fund and Gavi, and towards strong multilateralism and strong partnerships on an equal footing. The World Health Summit is one of the most important platforms in this joint effort. Let me close by thanking the Aga Khan University and the World Health Summit very much for hosting this regional meeting. And of course, a special thank you again to President Ruto and the Kenyan government, who is facilitating this meeting as an AU health champion and thereby lending it political weight. Let me close by also looking ahead. My minister, who is arriving tonight, will be traveling onward to the G7 meeting in Paris. And let me say that she will carry the messages coming from this meeting to the G7 discussions, which will also have a focus on health and global health security. So the messages from this meeting will be taken back to Europe and into the international discussions. Thank you very much for your attention.